Welcome to our webinar, Can You Solve the Opioid Crisis? Brought to you by Project Opioid USA. I'm Andre Bailey. For those of you that don't know me, I am the CEO and founder of Project Opioid, and we're going to be starting this webinar in about 30 seconds. This webinar is specifically for leaders in regions around America with a special emphasis on mayors, county elected officials and those that work for them, sheriffs, law enforcement, chiefs of police, and those that really are at the center of leadership on this opioid crisis in their community. We're going to be talking to a few experts today that are going to share more information on the current state of the crisis in 2023, and also encourage you to think about next steps on how you can impact the crisis in your community. We're going to go ahead and get started now with an opening video.
From coast to coast in every corner of the U.S., deaths from fentanyl overdoses are soaring. More than 100,000 people died from drug overdoses in a 12-month period ending in October of 2021. Recent CDC data revealing 2/3 of those deaths are linked to fentanyl, and those deaths doubling over the past 2 years.
These are tragic times when we are seeing over and over again deaths from opioid overdose, with fentanyl being the leading cause. And that's why you're on this webinar. Again, I'm Andre Bailey. I am the CEO and founder of Project Opioid. Project Opioid is a nonprofit advocacy organization that has a strong base in Florida, in California, and works across states to bring leaders together to impact this crisis. This webinar today, we're going to focus on a few specific areas, and we're so thankful that you're here on this webinar. We're going to focus today on some recent data. You're going to hear from Dr. Kendall Cortelyou, who is a member of the Project Opioid team, also with the University of Central Florida, on data on recent deaths that's come out. You guys have probably all seen this in the past week. We have the new numbers from 2022. Did the overdose crisis, did it recede at some level, or did we see another increase in deaths? We're going to talk about that in just a minute. We're going to talk a little bit about funding and how your community should be looking to use this new opioid settlement funds, as well as other sources of money to save lives. And what should you do what should you be investing in to save lives? We'll talk about that. We'll talk about aligning leaders around real solutions that matter. And again, how do we get treatment to those who are at risk? That's our webinar agenda today. Next slide, please. I want to talk to you for just a second about let me just stop and tell you, at any point, if you have questions, feel free to put them in the chat. We will do our best to answer them live. My staff's going to be texting me questions throughout. We usually can't answer all of them. We'll get back to you offline if we can't answer your question online. But if you have questions, put them in the chat. We'd love to hear from you today. Next slide. And let me focus for just a minute on some of our guests who are going to be presenting today. We've got three really good ones. Again, many of you know Dr. Kendall Cortelyou. She is a PhD healthcare. She's the leader of the Healthcare and Informatics Division of UCF, the University of Central Florida, my hometown. National Data Advisor for Project Opioid. She is one of the first that broke some of the newest data trends a few years ago. And so she's a national expert on data. We're going to hear from her in just a second. Next slide, please. We also have Ben Westhoff. You guys know Ben. Ben is the author of Fentanyl Incorporated. He is one of the foremost experts on fentanyl and how it has impacted this opioid crisis. He's going to be talking to us in just a minute as well and give us some updates on that. We're also going to hear from Ben Stewart. We have two Bens today, so don't be confused. Ben Stewart is the Director for State and Local Government for SAS, in the SAS Institute. SAS is the largest privately held data company in the world. They have a brand new overdose data system that they're debuting in the next few weeks. Very, very exciting. We're going to talk to you about how data can be used at a local level to save lives, and how technology is advancing and giving us another opportunity to navigate those who are struggling to get help. And so we're excited to have Ben, and we'll talk to him in just a minute. Let me tell you a little bit about Project Opioid, though, for a minute. What is Project Opioid? So Project Opioid is a nonprofit organization that focuses not just on the what of how to solve this overdose crisis. The what are things like medication-assisted treatment and harm reduction strategies and changing policy at the local, state, and federal level. So more resources are available. We talk about those things. But Project Opioid is not just about the what, but it's the who and the how. How do you bring all of the pieces together at your community's level and move strategy forward that can impact your community, bringing people together to engineer a movement to save lives? That's what Project Opioid does. That's why we're different, in my opinion, than a lot of folks out there. But I think for leaders on this webinar, sheriffs, chiefs of police, elected officials, other healthcare leaders, I think there's value to our mission and vision for you. Next slide, please. Project Opioid, again, is all about leaders coming together to save lives. We work with the corporate community, the faith community, the business community, as well as elected leaders and others like yourself. And we encourage you in your community, you're going to hear this from us today, build a coalition. Next slide, please. Use your leadership to build a coalition, create advocacy, and take those leaders on a journey to impact your community today. That's what Project Opioid is all about. And so we're excited to encourage you to build off the work you're doing right now. And we'd love to partner with you both now and in the future to increase your ability to bring leaders together and save lives. Go to the next slide. I'll double down on this just one more time and encourage you to focus a little bit as you think about how you're implementing these solutions today. Focus just a little bit on how you can bring other sectors of the community together to create solutions. So really, really quickly, I want to talk about a couple of things that we can really, really focus on in 2023. I'm going to bring Dr. Kendall Cortelyou in and talk about the new numbers. Spoiler alert, they're not good. We're seeing overdose deaths increase again in 2023. Shocking for many of us that overdoses continue to rise. But here's 4 things. If you don't hear anything else today, let me just start with these 4 things that you, mayor, elected leader on this webinar, a chief of staff to an elected leader, a law enforcement leaders on this webinar. Here's what you need to know about this crisis as we begin to talk about it in this 1-hour webinar. Next slide, please. Number 1, this is still about fentanyl driving this crisis. I cannot stress enough to you that for those of you that have worked on this opioid crisis for 5 years, 10 years, maybe 20 years, the crisis has changed right in front of our eyes. And where this started maybe 20 years ago as a Purdue Pharma prescription pill crisis, this has now turned into wholly a fentanyl crisis. Next slide, please. It's very simple. Fentanyl is the most dangerous drug, the most potent drug we've ever seen in the history of drugs in America. The precursor chemicals being produced in China, mostly being shipped to Mexico, the Mexican cartels, which we'll hear a lot about that topic from Ben, the author of Fentanyl Inc. in just a few minutes. But we're seeing fentanyl pour into this country. Very hard to stop. Look at that photo with what would be considered a dangerous amount of heroin versus what would be considered a possible fatal dose of fentanyl. Absolutely amazing how prolific fentanyl is at killing people. It is driving this crisis in ways we've never seen before. Again, Dr. Kendall is going to talk about that in just a minute. Next slide, please. Let's play this video. This is really brief, but for those of you that might not know how fentanyl is made, this is the cartels in Mexico making fentanyl. It is not made necessarily even in laboratories at times. It can be made in clandestine labs that are out in the woods by teenagers, and then put together into what we now see as fake drugs across America. Keep going forward, Amber. But the reason I show you that is because fentanyl is so deadly, and it is number two, killing our young people in just incredibly high rates. One of the reasons you're seeing so many deaths among young people, next slide, please, is the fentanyl you just saw being created in that clandestine outdoor lab in Mexico is being pressed into fake pills. A lot of you know this. I just want to reiterate to you that it is not prescription oxycodone that is killing people the way that it was 5 and 10 years ago. This is now fentanyl in fake cocaine, in fake heroin, in crack cocaine, and in fake prescription pills. Look at these pills in front of you. Which one would you have thought was real? Which one would you have thought was fake? We're seeing an incredible rise, next slide please, in the amount of deaths happening because of fake pills. The DEA recently reported that as many as 2 in 5 of the pills that have come in that are fake prescription pills, contain a lethal dose of fentanyl. I had heard a stat recently that there are already 1.5 billion lethal fake pills across the border in the United States, with another billion to come maybe over the next 12 months. So this is scary. Young people are dying. They're dying in record numbers. And now we have new waves of people that are losing their lives. We believe the stats bear out. Fentanyl combined with fake pills is a huge driver of this. Next slide, please. Also important to note, as much as this death rate is scary, it should make all of us take a minute and think about what the solutions are. We're seeing, next slide, please. We're seeing new solutions across states, California, Florida, all 50 states. We're seeing new options available where we can bring folks together, target those most vulnerable, most at risk, and new innovations in both treatment and in medications. FDA-approved medications are starting to give us just a glimmer of hope that we can impact this crisis in new ways. Next slide, please. Kind of just wrapping up this opening, I just want to say this. It's the most important thing Project Opioid can tell you. Again, if you're a mayor or an elected county leader or a sheriff or a chief of police, you have the ability to pull leaders together, pull them together and solve this crisis in your community. We can get help to those who are in need, but it takes a coalition of powerful, influential people. That's why you got invited to this webinar. And that's why we know that you can make a big difference. So leaders working together at a community level can solve this crisis. And we know that you are one of those leaders that's going to do that this year and beyond. So without further delay, let me also bring on my esteemed colleague, Dr. Kendall Cortelyou, PhD. Kendall, are you there?
I am. Hi, good afternoon.
Kendall, how's Zoom treating you these days?
So far, so good. I'm hoping the weather will let me keep my internet connection.
Wonderful, wonderful. Well, we appreciate, as always, you joining us. You are one of the foremost experts in America on the data driving this crisis. Kendall, I think you saw this headline. We'll start here. And this was just from May 18th. We were all waiting for the new numbers from 2022. And here they are. Drug overdose deaths hit a new record in 2022, closing in on 110,000 deaths. A lot of states seeing a huge surge, a handful of states seeing a decline. Fascinating. We're seeing some trends that you're going to unpack a little bit that need consideration. But go to the next slide. Kendall, I'll let you kind of talk through now. I'll hand the wheel over to you, maybe ask you some questions. But let's talk about these numbers. Break them down for our audience. What are you seeing?
Sure, absolutely. Thanks for having me, Andre, and I'm happy to be here to share what is not good news, though. We have seen that as the 2022 numbers closed out earlier this week or last week, we have seen that we're almost at 110,000 deaths in the United States from overdose. And so it's actually 109,680, I think, is the latest that we've seen, which is pretty flat with what we saw last year. So you can see in this chart here that really lays out what happened in 2019, 2020. We just saw a huge dramatic leap in the number of overdose deaths in the United States, and hoping, of course, that we would eventually start to see a decline because we have done some things. The United States has done some things, some states have done some things, and we haven't seen kind of that drop that we had hoped that we would.
Kendall, to give perspective to some folks, because we have leaders who don't work on this crisis every day. Again, I'm in constant contact with mayors and chiefs of police and elected leaders around America who have all kinds of responsibilities, roads, transportation, tourism, economic development. They're working on tons of issues in their community. And this is also incredibly important to them. But Kendall, to give some folks out there perspective, the death toll related to overdose in America in the year 2000 was roughly 17,000 Americans who died in the year 2000, right at the turn of Y2K, when we all were worried that our computers were going to go out and we would go into perpetual darkness because of those microchips. That never happened. But what did happen is now, instead of 17,000 deaths, 23 years later, it's 110,000 deaths. If you would have said in the year 2000 that we would be sitting at 110,000 deaths today, I don't think many people would have believed it. So although this chart shows that, since 2016, there's been an incredible rise. If you go back 20-ish years, there's very few issues I can think of that the death rate has skyrocketed like this.
Yeah, absolutely. And actually in 2017, when there was about 70,000 deaths, was when this was declared a state of emergency and a public health disaster. And since then, we have just seen this number continue to grow. So no, there's really nothing else like this in modern history where we have seen just this really dramatic increase in the number of overdose deaths.
Yep. So let's go to the next slide. Kendall, keep us going here. You got to keep us.
So sure. When you look at exactly what we were just talking about, even since 2019, we've seen a 52% increase in the number of overdose deaths. So while again, we have seen some plateauing out, the growth over time has just continued to rise just astronomically, very dramatically. Next slide, please.
Kendall, as you go into this next slide, let me just say something that a lot of people I know are thinking. There are people that'll put comments in the chats, and then some of the mayors will just text me on my phone right now. And one of the messages I recently got was, Andre, at some point, we often think of this as an issue of drug addiction and people who are making bad choices. And instead of being drug addicted for multiple years and dying, you're now drug addicted for multiple months and dying because of fentanyl. But at some point, don't these numbers kind of bear out that there are new populations dying for us to maintain this level of death?
It does. And, one of the interesting things, and we'll talk about it a little bit more, is the increase in the number of adolescents, individuals between the ages of 0 and 24, and just how dramatically overdose deaths have risen in that population. And what's happening and what the research shows is not that this age group is doing more drugs. In fact, drug-seeking behavior has remained the same since the dawn of time. People in that age group, especially adolescents, take drugs. But what's happened is that the drugs are so much more dangerous now. So we've really seen an increase in other populations, not the populations we typically consider, but again, other populations and drug overdoses in those younger age groups as well.
Got it. Next slide, please.
Yeah. So basically what we're looking at is we've got about 300 citizens of the United States that are dying every day of a drug overdose. And what this lays out is what they're dying of. So this is kind of a difficult thing to read, and I'm sure online it's probably harder. But the top line there is all opioids. So that's all opioids. But that next line, the kind of brownish line, are synthetic opioids, which really is fentanyl. So you can see this goes from January of 2025 until December of 2022. And you can see just this rapid rise of fentanyl deaths in the United States. So most opioid related deaths, most overdose deaths in general, are as a result of fentanyl. Now, there are other contributing drugs, obviously, as we see here, but so often now especially fentanyl is being mixed in with these drugs like cocaine, like methamphetamine. And I think that's really where we're seeing this very, very dramatic rise in the overdose deaths. So fentanyl is still the major driver in the overdose deaths in the United States. Next slide.
Kendall, we have a question from Bethany, which I think is a really good question. Do these numbers, and I know the answer, but I just want to ask the question because I think it's so shocking. Do these numbers include those who overdosed, but then were revived with Narcan? No, these are just deaths. Guys, there are estimates I've heard. I don't think we have a solid number, but there are estimates I've heard that without naloxone, which is known as Narcan, some people know it as Cloxato. There's other versions of naloxone, again, most commonly known as Narcan. But without Narcan, the death rate would be 4 to 5 times. We'd see 500,000 deaths a year, potentially without Narcan. So these, Kendall, are just numbers of deaths. Overdoses are probably exponentially higher than this.
Absolutely. For a rule of thumb kind of is that there's usually 4 to 5 non-fatal overdoses for every fatal overdose. That doesn't always bear out. And it very much depends on geography and a lot of other complicating factors. But yes, these are just fatal overdoses. These are just people who have died.
Kendall, let me also mention, just because I know some of the folks are asking this question, why is fentanyl so popular? Why is it being put into all of these drugs? I know Ben Westhoff, Fentanyl Inc. author, is going to talk about this in literally just 5 minutes. But I think the easiest answer to that is that fentanyl is dirt cheap to produce. It is a chemical compound. It's not, if you were going to make a heroin, and you were the cartels 10, 15 years ago, you had to have the opium poppy. You had to have a plant that was very valuable, that originated in nature to start with. Now they can make fentanyl for literally 2 cents on the dollar compared to old drugs. It's the most profitable drug in the history of illicit drugs. That's why has replaced. Basically, what this chart says, everyone, is fentanyl has now replaced every other drug in this country.
The other thing is that fentanyl is highly addictive. And so drug dealers trying to make profit, the more people that are addicted, then the more the profit they will make. So it's very cheap and it's very, very addictive. And it also works with these other drugs and really amplifies the sensation that the user gets as well.
And as we move to the next slide, let me just say this to you, Mayor, Chief of Police, Sheriff, if you're still out there doing drug take-back days like prescription oxycodone, we're not against those. We're not against sensible policies on prescriptions. But leaders, that is not what's killing the people in your community. Look at this line. It's almost exclusively death by fentanyl in your community. Next slide, please.
So here, this again is just looking at really the last 3 years of fentanyl deaths in the United States. Again, we can see that we've seen a major rise and then more of a flattening because fentanyl is really pushing the numbers for the overdose crisis in general. You can see that it follows very much the same trajectory. Next slide, please. So, but as you mentioned, Andre, earlier, this is a map of the United States from the CDC that shows the percent change of drug overdoses between 2021 and 2022. And you can see that some states are doing better. The blue is better, whereas other states are doing worse. So, yeah.
Oh, Kendall, I just want to note for some of you out there, and we're going to send all of this to you in an email, that some of the percentage changes are smaller versus others, right, Kendall? So there's a few states that have had dramatic changes, but even like Florida, my home state, which I'm very proud of some of the work I've seen happen in Florida, the percentage change is pretty minuscule.
Yeah, it's about 1% in Florida. Again, I'm based in Florida as well. So yeah, it's about 1% in Florida, which is not a significant change, obviously. Whereas the darker blue states have seen a better shift, and then the darker kind of brownish states have seen a worse shift. But it is important to note when you look at these that in fact the numbers, the N, as we say, for some of these states is very small. So, all of this needs to be interpreted with a word of caution, but I do think that it is important to note that while overall the United States has risen about 0.6% in the last year, some places are doing better than others.
Yep. We're going to dive into that. I know you're working on some new research that we'll cover in the months to come.
Yes, absolutely. There's some really good, exciting research that I'm working on to help us identify what factors are driving some communities to do better and some communities to not and to fall behind. Next slide, please. So this is some interesting information that I really want to share with this group. And we talked a little bit about it earlier, Andre, but this is the overdose deaths for those between the ages of 0 and 24. 0 and 24 in the United States between 1999 and 2021. The 2022 data is brand new, and so the age data is not available yet. But if you look at this back to 99, you can see that the overdose rate has been trending up. We won a little bit in the mid, 2015, 2017, but then we've seen just this enormous spike since 2019, 2020, and 2021. So I think this is a really important lesson for mayors and police and law enforcement to understand that the demographics for the overdose crisis is changing, and it's changing significantly.
Got it. I think we're wrapping up right now, Kendall, but let's see your final slide.
And this, again, goes to not because they're taking more drugs, but because they're taking different drugs. And so if you look here, that line that shoots straight up is fentanyl. And so these are mortality rates among adolescents. And you can see, again, that we've seen a huge spike in fentanyl-related overdose deaths.
None of this is good news. Next slide, please. And again, we know that, go ahead, Kendall. I think this is your last slide.
Yes, this is my last slide. So I just wanted to make everyone aware that the DEA has now put a public safety alert out for fentanyl mixed with xylazine. Xylazine is a veterinary drug that has made its way into the drug system, and it is now being mixed with fentanyl, which has really exacerbated the fentanyl crisis, particularly, again, in the adolescent years. Got
it. Dr. Kendall Cortelyou, thank you so much. Stay on, please. We got some questions in the chat people want you to answer. Next slide, please. Again, that's why Project Opioid is here. We're here to help community leaders solve this crisis. Amber, go ahead and skip past that video for time's sake. Let's bring Ben on. We'll send this video out to everyone. Ben Westhoff, investigative reporter, author of Fentanyl Inc., excuse me. Ben, are you there?
Yes. Thanks for having me, Andre.
No problem. Ben, you hear these new numbers. It sounds like a lot of the same that you've been saying for years.
Yeah, fentanyl is the worst drug epidemic in American history, and it doesn't look like it's getting better anytime soon.
Got it. Well, Ben, I'm going to turn the steering wheel over to you. Let you kind of talk us through for a few minutes some information you want to share on fentanyl that I think we've got a lot of questions about the southern border, about enforcement. About that for 5 or 6 minutes. I'm going to ask you some questions, and I think we're going to ask you some questions we're getting in the chat right now.
Okay, great. So yeah, in 2010, I had a friend who died from fentanyl. And so I started learning everything I could about the drug. I published my book, Fentanyl Inc. in 2019, and we were well on our way towards fentanyl becoming the worst drug epidemic really that we've ever seen. Can go to the next slide. So I kept hearing it was made in China, but no one had done any reporting about this. So I just Googled buy fentanyl in China, and all of these companies' websites came up. So I decided to make a fake avatar as a drug dealer, and I called myself Johnny Webster. You can see in the top left corner. And I started messaging with all these salespeople and lab owners. And I said, if I want to buy fentanyl and I come to China, could I see your lab? Some of them said yes. And so bought a plane ticket to China. You can go to the next slide.
Ben, what year was this? I think
this was 2018. Yeah.
Okay.
So I went to Shanghai inside a lab, and then I went here to Wuhan. This was just prior to the pandemic. And I was blown away by what I saw. This was a regular sales floor, hundreds of young people working on computers at cubicles, except they were selling the ingredients for fentanyl, the most dangerous drug, and they were selling it to the Mexican cartels. I pretended to be a buyer. I didn't actually buy anything. No money changed hands, but they showed me the fake packaging that they send these chemicals over. And so really that is the pipeline. It's all these chemicals start in China. They're sent to Mexico, where the cartels finish the fentanyl, and then they send it across the border into the US.
Hey, so Ben, real quick, because my chat and my phone are blowing up right now because people are struggling to believe what you're saying. We all have this Breaking Bad, Walter White, guns and private staircase conversations around buying these chemicals. You went on the internet, took 2 minutes, created a fake profile, flew over, and there's a call center that just serves up fentanyl, the chemicals, the precursors. Is that what you're telling us?
Yeah, it blew my mind. I mean, these are all young college graduates. They get like health insurance at this job. I mean, this is it's almost like a Fortune 500 style company.
Amazing.
So yeah, so you can go to the next slide. And I later went to the US-Mexico border to understand how the drugs get into the US. And I went with an agent, and what he told me was that he believed that less than 1% of the drugs sent across the border are intercepted. They have all sorts of ways for getting it across. They go in cars and secret compartments, via drones. I even heard about drug cartels taking drugs across on surfboards, just surfing around the wall and coming in. So what I learned from all this is basically that we're not going to stop drugs from getting into this country. What we need to do instead, and this is something that we can all take away, is that we need to help our own people who are suffering from drug addiction. In fact, I have 2 specific action plans. You can go to the next slide.
Hey, Ben, let me pop in right here because we've got some questions on this. Amber, go back 1 slide real quick. Let's stay on that wall for just a second. We love wall conversations in this country over the past 5 or 6 years. So, Ben, I want to say this to you, and I think there's a lot of people that are passionate about this. I agree with you that although trying to enforce having drug enforcement at the border is something admirable, the size of fentanyl and how cheap it is to produce, what you're saying is this: if we think we're going to stop this from coming into the United States as a solution to this crisis, It's just probably not possible. Is that a fair assessment of what you're saying?
Yeah, I mean, we couldn't stop heroin from getting in, right? And now 1 kilogram of fentanyl is the same as 50 kilograms of heroin. So if we couldn't
Yep.
stop 50 from coming in, how can we stop one? So
Yep. Yep. Agreed. So again, I know it's a controversial topic. We want to believe that enforcement is the answer at the border, and enforcement, is an important conversation. But fentanyl is pouring in, and we have not even the beginnings of stopping it at this point. Go ahead, back to his other slide. Thanks, Amber.
yeah, I mean, if what we want to do is stop deaths, and I think that's what people want to do, I think we have to focus on people who are addicted. And the vast majority of the fentanyl deaths come from people who are addicted to opioids. So OUD refers to opioid use disorder. It just means addicted people. And we're lucky enough to have 3 good drugs to help with opioid treatment. There's methadone, buprenorphine, and naltrexone. They have different ways of working. There's a lot of debate about which is best, but 85% of addicted users don't get these at all. When I talk to people living in the inner city, urban communities, African American populations, these are the most affected recently by this crisis. And the people I talk to, they don't even know these drugs are available, much less that, especially in Medicaid expansion states, these drugs are often available for free.
Ben, one way I say it is this way. And by the way, Ben, 6 years ago, I was like you. I didn't know one thing about the opioid crisis. I'm assuming that you were like that. Forgive me if you already did know a lot about it. But I didn't know about these FDA-approved drugs like you're showing on the screen here that can absolutely be a lifeline to people who are struggling. So if you're a mayor, a county leader, a sheriff, a chief of police, learn about what your community is offering as far as FDA-approved drugs that can help someone who's struggling. Ben, it really has to be the future of this crisis.
Yeah, I completely agree. I mean, it's like during COVID, we were searching desperately for the vaccine, right? Well, for opioids, we already kind of have a vaccine, naltrexone functions that way. Methadone and buprenorphine, people can take it, and it takes away the cravings, makes them much less likely to die because they don't have to steal and rob to get, fentanyl and heroin, and they won't overdose.
Amazing.
So you can go to the next slide. My second action plan is education. So I was very dismayed to see this headline last September that 50% of Arizona 8th graders have never even heard of fentanyl. And I know that's very similar throughout the country. Kids, they go to a party, someone hands them a pill. It looks like a Xanax. It looks like a Percocet. They think, well, this is what my parents have in their medicine cabinet. This is medicine. But in reality, these drugs are very often cut with fentanyl. They look exactly the same for the most part. And one pill can kill, young people can kill anyone. And so I think we need a new kind of state level, federal level, whatever it takes, an education campaign to tell people about this, young people especially. Something like DARE, DARE sometimes was criticized because it was scaremongering, maybe, but we don't need scaremongering. We just need to tell people the truth, and that's scary enough.
Yeah, Ben, we had a question in the chat. I'm going to throw it in here now about medication-assisted treatment. I think it's a fair question. And again, as I told you, as you got ready for this webinar, what we love about our webinars here at Project Opioid is how many elected leaders, sheriffs, healthcare officials, and others who don't have a tremendous amount of experience with this crisis come on, learn. And so there is no dumb question in our world. But there was a question about medication-assisted treatment, and isn't it just as addictive as fentanyl? And I would just say that I've had a chance to see folks, especially on buprenorphine, newer FDA-approved, long-lasting injectable versions of buprenorphine like Sublocade, and it is not addictive. These folks are not high. They're not altered. I think methadone is a drug that many struggle with, and I myself am happy there are better options now. But Ben, I think there are misconceptions, because these newer drugs especially can protect someone and really allow them to live the same life they lived before. Isn't that your experience?
Yeah, and I'm particularly fond of what's called Vivitrol. It's a type of naltrexone, and that is non-addictive completely. It's an opioid blocker. The Vivitrol shot lasts 30 days, and you can take heroin or take fentanyl during that time, and it will just bounce right off the receptors. So yeah, so these three drugs, some are better for some people, some are better for others, but they're all much better than being on nothing. So yeah, next slide. So yeah, feel free to reach out if you have any more questions. And thank you all for your interest in this. And I think that the important takeaway is that we don't have to sit by and feel helpless. There are real solutions that we can enact today and make a difference.
Thank you, Ben. I'm going to ask you one question in the chat that I think you're very, very apt to answer. Jim Hill says, China instituted a suppression policy specific to precursor chemical production and distribution. The major players simply move production and distribution to India. What are you seeing in 2023 as compared to 2018 on the laboratories and the industry in China today? What's your new update?
Yeah, I mean, the thing is, China has the biggest pharmaceutical industry in the world. India is second. So most of those industries are legit, but there's always going to be some people in this, you could call it a gray market. These are chemicals that are legal in China or legal in India, but illegal in the US. And so the problem is that whenever China bans one of these drugs, the chemists just subtly tweak the molecule. So now all of a sudden they've got something that's just about the same. You can still make fentanyl out of it, but it's legal. And so that goes to my bigger premise that even if we stop China, even if we stop India, it's just going to go somewhere else. You know, Russia might be next.
Got it. Ben Westhoff, I encourage you right now, go online, go on Amazon, buy Fentanyl Inc. Ben, thank you. Stay on. There's some questions that people have for you in the chat. If you have a minute, I know you have a 2 o'clock, but thank you so much for joining us. We're going to take a minute to learn about we're going to get you guys off in 18 minutes. We never go late on the Project Opioid webinars. So keep going forward, Amber. Questions in the chat, please throw them out there. All right, now we are excited to take a minute to talk to Ben Stewart. Ben is the Director for State and Local Government for SAS. SAS, as I have learned recently, is the largest private data company in the world. They are working with local governments, hospitals, Fortune 500 companies around America, around the world, and recently have been pioneering behind the scenes. You guys on this webinar are going to be the first to know about what I think is going to be a groundbreaking software that can answer this question, and that is how data can help communities solve the opioid overdose crisis. Ben, here's this great biopic of you. I like the long hair, man. Was this during COVID?
This is a family picture, man. I think at some point I need to get an actual headshot, but today's not that day.
Well, we're so happy to have you on either way, and to discuss again for the first time, the mayors, the county leaders, sheriffs, and others on this webinar are the first to hear about a new product that SAS has produced in partnership with Project Opioid, kind of picking up on some of the amazing work SAS has done previously on the opioid crisis. So Ben, we're so excited to have you on and to hear more about this.
Well, it's such a pleasure being here, and it means a lot to have the invitation to speak to you again and your people. Thank you. So next slide, please. So at a very high level, a little bit about what SAS does in government, and then specifically around opioids. So as Andre was saying, we are partners with many national governments here in the United States, almost every federal agency, national security. What's near and dear to my heart is state and local government. And with state and local government, we've been partnering on some of the most complex issues that have been facing us for more than 20 years now. Specific to opioids, though, which is why we're all here today. We've been doing a variety of things, creating dashboards, predictive models to better understand what are the large contributing factors of problems in our communities. And what you're looking at now is just one of many examples that we've built. So obviously that's the state of New Jersey. New Jersey came to us because they were wanting to take healthcare data and criminal justice data, put it together and get more value out of it. So a couple examples of what we did for New Jersey was that we started doing naloxone hotspotting so that they knew where the majority of their need was, so they could connect that to their communities more successfully. And also from a law enforcement perspective, they wanted to see some of the criminal rings that were bringing these legal substances into their state so they could better get in front of those issues.
Next slide. Ben, you've done some great work on the opioid crisis, but when I met your team a few months ago in your Florida office, I met with Mark and Heather and the Markman Impact folks. I think the conversation was pretty somber because despite some of the best efforts of SAS and really thousands of advocates, tens of thousands of advocates around America, we see the overdose crisis getting worse. We've heard the numbers again today on the webinar, over 100,000 deaths. I mean, this has to be heartbreaking for you and your team at SAS as well.
It's exactly what we've been talking about today. That line is not where it needs to be. And a lot of people are doing what they can in the private sector, NGOs, local governments. And what we're looking at is, that's the scoreboard, to tell you the truth. And so when we saw this, we knew that we had to do something different and we had to take a different approach if we were going to impact our communities and be the sorts of partner that we hold ourselves out to be, Andre.
Well, and that's where you guys got to work. And again, I'm so excited and I'm privileged that I have had the opportunity to work with you over the last season of time on this new product that I think is going to revolutionize how communities impact the opioid crisis. But it really started not with solutions, but with problems that you guys were trying to solve.
Absolutely. And we're a data company. So please, everything that I'm going to be talking about comes from that data lens, Andre. But there's a variety of things that we've seen during our over 10 years on different parts of this problem. The first is that treatment can be sporadic, and the way that information comes back to us around was the treatment successful, who got it, and what's the next step. Sometimes it's track poorly or track not at all. Second thing is it's difficult to find help. People in our community may not know what the right next step is for them or even where to go to find it. The third is that there's really not a cost basis. How much does a successful treatment cost? Where do I go to find it? Who are my providers that are doing the best work in my community? The fourth is that everyone really has their own journey. This is a very individualized problem. And today, companies like ours have been looking at it from, at best, a community perspective, if not a state or a national perspective. And the last thing is we just don't have time, Andre. As the substances are getting stronger, as one bad experience could lead to death, we need to shorten the time that we can put the right answer in the right people's hands.
And so as we were talking about what's missing, again, from a data standpoint, that community leaders have to have to impact this crisis, what is the basis of this new product people are going to hear about? What did you guys find?
So the new product is called Moment. And the reason why is that speed matters. We need to be sure that in the moment of crisis, that there's a step that can be taken so that the community resources can be committed and brought to bear in a way that's going to save a life. And what you taught us, Andre, and the more that we spoke, was how do we do a couple things well? One, how do we have a community-specific resource connection? How do we know the providers, the capacity, simple things like distance, right? Does that provider have the ability to go and have a mobile unit deployed? The second part about this always comes back to the person in crisis. We need to have a real-time way to meet that person, to understand their specific individual characteristics, and then provide them the best recommendation possible about where to go to get help. And that's it. Go ahead, please.
ultimately it leads to a connection to the treatment necessary. And again, one more slide where you guys talked about what
great. Everyone loves them. But what we want to do is be a part of saving lives. And if through your leadership and the way that you've described how to really access the information that we need to deploy all those great things that we do, that final mile is something that we didn't have the perspective before we spoke to you and your team. So for us, it's a passion. It's more than a passion. It gives us purpose in why we build all this technology. And it's going to allow us to do good in a way that we couldn't before.
So for communities who are interested, there's kind of two things we want you to hear. By the way, if you're on this webinar, Ben, these are the first community leaders in America to hear about this software that I believe over the next year, 2 years is going to revolutionize our ability to save lives. We lost another 100,000 young Americans, vulnerable Americans in 2022. This software, I'm telling you, is going to be the breakthrough that communities need. So Ben, if someone's interested, what do you recommend?
Absolutely. So as you heard, we've done a variety of things, but this final mile that we talked about today, we're going to pick a handful of communities and we're going to do the initial pilot launch of this, and we're going to be doing it this summer. So Andre, we're actually interviewing communities now. And what our goal is to do is to find some really good peer examples so that when we roll this out nationally in 24 and 25, there's going to be that peer-to-peer relationship. This is how this was deployed in our community. This is what we saw as successful. Because we know that it's great for us to to have numbers and all the things that we typically use, but the ability for peer communities to talk about how they lived through this and how this potentially revolutionized the problem in their backyard, that's really where we want to be sure those are the messengers.
Got it. Ben Stewart, Director for State and Local Government, SAS, thank you so much. And again, I just want to reiterate, I know you guys are in the business of creating software that changes the world, but this is a solution that ultimately, Ben, you and your team have put your hands on that can save lives. So just a big thank you again, Ben. All your information is going to be in the chat right now. There's also a link being dropped in the chat right now for people who want to sign up for that 30-minute June information session that SAS is going to be putting on. If you're a mayor, a county leader, a sheriff, a hospital system, get more information on this software. It's going to empower your community to navigate those in need to life-changing resources. Ben, thank you again so much.
Thank you so much for having me. It's been a pleasure, Andre.
Again, thank you, Ben, for joining us. And if you want more information, we're packing a lot into this webinar. We have 8 minutes left. We are going to get you out of here in 8 minutes. If you want more information on SAS and how they're going to use data in communities across America, what Ben was saying is this new groundbreaking software, which has not debuted yet, is debuting in August, called the SAS Regional Overdose Prevention Software. If you're interested in using this, get more information. There's a QR code there. Next slide. I also want to say this. We've just got a few minutes left. Next slide. That as you look towards this solution and data, our next webinar, we're going to get you information on that in just a minute as well. But again, how do we take public policy, data, leadership, build collaboratives, and then save lives? Let me, with 5 minutes left, give you 5 things that you need to be thinking about around this overdose crisis. Next slide, please. 2023, the numbers are clear that we have to expand naloxone anywhere and everywhere. Ben Westhoff was talking about medication-assisted treatment. For some people, that's controversial. We're going to make it less controversial for you. As you learn about it, you're going to get comfortable with the fact that it is not addictive and it saves lives. But naloxone is not controversial at all. Whether it's Narcan or Project Opioid, we're also distributing something called Cloxato, double strength Narcan. There's a new drug on the market called Nilazine. It's like 20 times more powerful than Narcan. Listen, We are in favor of all of these overdose reversal agents. You need to make sure your community has Narcan, naloxone, Cloxato, all of this available, and it's saving countless lives, as we've just learned. Next slide, please. Again, this is Cloxato. Next slide, please. We also want to focus on the fact that MAT, medication-assisted treatment. Again, guys, listen, you don't have to trust me. Trust ChatGPT and Google. Go online right now. Learn about new FDA-approved medications that really act as a blocker for opioids and for those who are struggling. Next slide, please. We are seeing that folks need this as part of their community's response. That's why you're also going to be hearing about Project Opioid's Overdose Initiative. We're going to want to coach you in the next few months. You'll hear more about this on building your coalition, putting your own data together, and using MAT as part of one of your community action steps with naloxone and with other important aspects of this work. So more about that coming in the June webinar. Next slide, please. With 5 minutes left, I also just want to say 5 things you need to do. Educate your young people. Ben's slide was so shocking. 50% of those surveyed in that article, young people, 8th graders, had not heard about what was and is the most common form of death for them, overdose now. And so we have to educate our young people. Next slide, Project Opioid. You guys are doing education. We're seeing education happen all over America. We're launching a new campaign called What's the Fix, which is going to be Gen Z and millennial focused, talking to Gen Z and millennials. There was a question in the chat. I don't want to get deep into it, but it was basically asking, why are so many young people dying? Some of them already know they're struggling, that drugs are bad and will kill them now. I think there's also a mental health crisis in this country that correlates at some level and is important to talk about when it comes to Gen Z and millennials. We have to educate them on drugs. We also have to acknowledge their struggles. Number 4, collaborate. Mayor, county leader, the sheriff of Santa Barbara, who is a Project Opioid partner, is on this call. Chiefs of police are on this call. Listen, bring together a coalition that will foster hope and recovery. Collaborate, otherwise known as you are someone powerful in your community. Bring together a group. Next slide, please. What we have seen is when you pull together the following types of leaders, screenshot this, mayor, county leader, sheriff, chief of police, screenshot this and go out today and start thinking about how you're going to pull together a coalition of the most powerful people in your community to impact this crisis. These groups need to be represented. These are the groups that can make big impact. Next slide, please. And last but not least, also navigating people to help is going to be so critical. That SaaS software we believe is going to be critical at doing this as well. Next slide, please. With 3 minutes left, I just also want to remind you maybe the most important thing we can tell you today as we conclude. And again, a huge thank you to Ben Westhoff, author of Fentanyl Inc., Ben Stewart, Vice President, State and Local Government for SAS, and Dr. Kendall Corderu. But as we conclude in the next 2 minutes, lead with compassion, leave stigma behind. Next slide. If you look at this crisis, this is just one of 110,000 stories I could tell. There's 110,000 of these stories to tell. This was just sent to us by the parents of Justin Bruce Forrester. Justin was in recovery. He was doing better. He had his whole life in front of him after struggling with drugs. But he had one bad day, got himself a pill that he thought was just opioids, but it had fentanyl, synthetic opioids in the form of fentanyl. He died February 22nd, 2022. Justin is one of 110,000 young people. Guys, this is not a crisis. It's not an issue. It's not a drug problem. It's Justin. It's Sally. It's Mark. It's all of these young people dying. We have to lead with compassion and realize that drugs are more powerful than ever. They're scarier than ever. And that heart and compassion has to lead you. to build solutions that matter. Next slide, please. 60 seconds left. I just want to again thank our guests. Register for our upcoming webinars. We're going to be talking about the settlement money, June 28th. How do you spend money, draw down as much money as possible in your community? QR code there for the national webinar. The SaaS info session, we're going to make that available. If you're interested in a new data system your community can use on the opioid crisis, we're going to be sending you this PowerPoint. We're going to send you videos, so you'll get that in your inbox in the next 24 hours. Finally, let me just show you a slide where you can contact us if you need to contact us. Final slide, next slide, please. In our last 30, 60 seconds, screenshot this. If you want to get a hold of us, this is our team. We can also give you Ben's information if you want to bring him in to do an event in your community. He is incredible. Again, huge thank you to all of our partners, Florida, all of our Florida, California partners around America. Thank you for being a part of this solution. We're out of time. Contact us if we can help you and your community impact this crisis. Again, I'm Andre Bailey, founder and chief executive officer, Project Opioid. On behalf of all of our leaders, thank you so much. Let today be the day that you bring together the leaders that can solve this crisis, and we would love to help you do that. Contact us today. Thank you so much, everyone. Have a great day.